Thank you very much, and good afternoon, everyone. It's always a pleasure to see such a wonderful audience and full hall for a talk which is focused upon health or discussion which is focused upon health. Till a few years ago, we would not have imagined that there would be so much of interest in public health, in rural and urban health. Though we wish so much, but the stark reality is that health rarely gets policy or CSR attention, at least not before COVID-19 pandemic. So though pandemic or COVID-19 pandemic has done a lot of damage, played havoc, but as an individual, as human being, we should always be looking for positive sides, silver linings, as they say. And one of the positive thing or silver lining of this pandemic is that health is starting to get due policy attention, due attention at different level. The simple or bare fact that we are discussing this, a large or a significant proportion of credit going to the COVID-19 pandemic. But that is not given that this attention would be sustained. It is likely that it may be forgotten. And that's why today's conversation is really very important, that health should not be forgotten in CSR-related conversation, in non-governmental or non-for-profit organizations' work. So that's what we will try to do in next 45 minutes. I have a wonderful panel of experts or individuals who would take this agenda forward. But before that, let me outline what we are going to discuss. The fact is that at the policy level, at national and global level, even before pandemic, there was a discourse going on, which was called, some of you might have heard, universal health coverage. The entire global community is talking about that health services should be accessible, affordable, and good quality for every single individual. So the last person of society need to have access to healthcare services. Now, can you imagine who would be the most deprived, about whom we should be talking about? So often I'm asked this question, that who is the last person? So one of the example could be an elderly, widow, illiterate women who is alone and there is no one in that family, who lives in a remote tribal village of this part of the country. So elderly, widow, illiterate woman who lives in a remote tribal village could be a representative of the most deprived individual. And we can say that India has achieved that kind of status, universal health coverage, when that elderly, widow, tribal woman in a remote village need not to think twice when she falls sick that where she would go. She did not have to worry that if she had to seek care, whether she would be receive those health services, how she will be treated by those individuals, and she would not have to worry about the financial cost of those interventions. And that day we can say that our task in health is cut out or completed. But we are further away from that. Governments are doing a number of things, but we know that there are people who are deprived of all of those essential health services. Bare fact, like a migrant laborer who comes to a city like Delhi or Mumbai, they keep delaying health seeking. The pregnant women within those migrant communities do not seek health services and still deliver at home. These are the realities. And that's where the role of corporate, not-for-profit organizations and such kind of dialogues is. And in this backdrop, let me invite my first panelist to reflect about that. How does he, Mr. Rajesh Ayapilla, this question is directed to you. I would like to hear from you that how do you see that after COVID-19 pandemic and after we know all of the challenges in healthcare, how the CSR landscape is going to change in the days, weeks, and months ahead? Thank you.
Thank you, Dr. Lahariya. So, before looking forward, I would like to take a step back and see in terms of how CSR actually supported the work during COVID. the first wave of COVID, when it came, the entire focus was providing food, rations, support to the migrant laborers and all of that. We didn't have a vaccine. We didn't know how to solve the problem. But when the second wave of COVID came, the Delta variant and all those other variants which started coming in, we had developed a vaccine. So the challenge for the government, for the society, for corporations, for individuals, everybody, was to support the delivery of those vaccines to the larger masses. And this challenge is a multi-pronged challenge which we faced. First of all, there were misconceptions. People thought, if I take this vaccine, maybe if I'm pregnant, my child might be deformed or something like that. If I'm old, I've got some other comorbidities, it might impact me. So the first important objective of this entire operation was to create mass awareness, to ensure that we pass the right message to the larger population. The second leg of the challenge was actually to create facilities, or at least upgrade the facilities so that the vaccination could be given to the people. The people who don't have access to, say, wireless internet, who could not register on all those apps, Cowin app, Arogya Setu app, so and so, who didn't have the necessary documentation to be submitted. So we kind of like worked towards upgrading these facilities. We focused on almost like 25 districts, 4,000 plus villages across the country. And we were actually targeting an outreach of close to around 50 lakh people. And the third one is to actually reach out to those people who do not have the ability to go and get vaccinated, to facilitate them to go and get vaccinated. So as a result, we achieved some admirable numbers. We actually needed the right partner who had the right kind of scale, who had the right kind of connect at the local level to do that. And I'm very happy to say that in this case, we partnered with United Ways Mumbai, and they were able to deliver that. But having said that, coming back to your question, how do we see CSR going forward? I think the learnings that each of these corporates had, almost every corporate participated in some way or the other. I think these learnings can be taken up into our future projects. They might not necessarily be directly related to health. Maybe if you are working with a cohort of waste workers, how can we pass on health to them? How do we ensure that they will have access to all the schemes that the government is providing, whether it's insurance or some other stuff? How do we raise the awareness level of those set of people who are actually at the bottom of the society? So I think these are a couple of things which I see as learnings out of what we had experienced and would like to do for. Thank you.
Thank you very much. So I heard you that you said that your setup, your organization was involved through the CSR in not only raising awareness, but improving or upgrading health facilities. There is a very important message in what you said. I personally believe that many times we give a lot of importance on raising awareness, telling people that they should adopt a healthy lifestyle or seek health care. They actually do, but when they go to health facility, they are not delivering those services. So it's very important that we raise awareness and we actually implement on the ground and upgrade services. So thank you very much for that. But I want to quickly follow up with you. And this is a difficult one, but I still want to say that if, let's say, do you want to give a ballpark number in a sense that if, let's say, for health sector, before COVID-19, XYZ amount of CSR funding was coming, what do you see like XYG plus what proportion or what percentage would increase might happen in the time ahead? Do you want to make a guess?
I would not like to hazard a guess, but what I would see is that we might not maintain the same level of funding which we are doing during COVID, but each of the corporates are at least now aware that they do have a responsibility towards this particular activity. And it should form a sizable part of whatever funding could be available.
Thank you very much. I think the message is fairly clear that we need to continue this dialogue, and health sector demand more CSR contribution than till now. Moving quickly to someone who has already been engaged in this area for a while, Ms. Anjali Katoch, this question directed toward you. You have worked in a not-for-profit sector and area of health for many years. My question to you is that what you can, or as a not-for-profit sector, do to ensure that health attention is sustained on the health, and both in rural and urban areas, and how local governments and other organizations can work together to ensure that the most marginalized community individual continue to receive attention, and also there is a sustained flow for CSR funding in this area.
Sure. Am I audible? All right. So, Dr. Chandrakant, when if you know anything about Smile Train, so Smile Train already does very specialized care. So we are a charity which is focused on providing end-to-end treatment for children born with cleft lip and palate. It is a very specialized sort of care, not usually available, outside of cities. But in the last 22 years, the way we work, and I can just share my experiences, as is the topic of this panel, is that for something as specialized as cleft, you mentioned, for you the goal value is when that tribal woman in a remote village, has access to equitable, high quality care. I would say for me, the gold standard is when a child from a below poverty line family born with a cleft, his parents know immediately what to do and where to take him, and that treatment, high quality treatment is available for this child. I think the biggest challenge is awareness, and that is across. I was listening to Anshu, the very fact that 60 million Indians need glasses and don't have them. I think one of the reasons is lack of awareness there itself. And the same is true for cleft. When a child is born with a cleft, parents don't know how to take care of that child. And I would say that even general practitioners, doctors near their homes are not aware of the timelines of cleft care treatment. So what exactly needs to be done? What should be done to take care of this child? I had 2 slides. If they could be played, please. So just to reiterate, if we go by a recent study done by IHME, children or babies with cleft under the age of 5 are twice as likely to be malnutritioned as other children under 5. When you see India's statistics, that is a very, very alarming fact. These kids, because of the gap in the lip and palate, need immediate intervention. Their mothers need to be taught how to feed the baby. That information is not available. So the first thing is awareness is key, and as an organization, we have put a lot of efforts into creating that awareness, making sure that these resources are available with primary healthcare workers. We have a toll-free number which is supported by one of our corporate partners, GSK. Anyone can call in from across the country and get information about how to feed their child, where to take their child for treatment. So that is first. Second is accessibility of care. I think that is very, very key. And high quality cleft care needs to be available close to your own home. And our model is such that we work with local hospitals. Yeah, we don't do camps because we don't consider camps to be a long-term sustainable solution for any long-term intervention. So we work with local hospitals, we partner with them, we build their capacities, we fund treatment there, and that way children get treatment close to their homes. And I think third thing, which I feel is extremely important in today's world, is technology as an enabler. So technology and data aggregation, data analysis is important. As an NGO, we have the world's largest cloud-based database of medical records. More than 1.5 million cleft patients' records are with us. This is a cloud-based system. We are able to analyze this data and keep improving our medical delivery systems. So I think digitization of medical data and using technology is very important. And fourth is just aggregation of resources. I think that's really key. Each one of us here is from either an NGO or a corporate. We are all doing excellent work in our own little fields, in our own little silos. But what if we could just bring everything together? Could you change my slide, please? Yeah. So the fact is that if Smile Train is an expert in cleft care, but someone else is doing interventions in nutrition, they have mobile medical vans which are doing primary health care, those children with clefts can also benefit and be routed to Smile Train. But at this point of time, I think those kind of aggregations are still very low. And I think together we should work together. We should aggregate data about all our interventions and really bring them together. We are working with some state governments where, the Rashtriya Bal Swasthya Karyakram is identifying children with clefts and, sending them to our centers for treatment. I think that is a really good step, but it's still just a start. I think even corporates who are working in primary healthcare or working in certain districts, they could also aggregate data. We could all help each other. Somebody is an expert in some field, someone is doing something else beautifully. Why don't we work together so that we can actually bring public health delivery to every citizen of India? Thank you.
Thank you very much. So what you just narrated is very good example of a case where we can argue that while government are every passing day starting new initiative, Rashtriya Bal Swasthya Karyakram, and different initiative, private sector is also doing different activities, but there would always be role for not-for-profit organization because they have their eye focused upon specific intervention and aims to reach those targeted population which probably are left behind in spite of government and private sector facility. And then you narrated the example that how a new government initiative also sent children to the Smile Train for intervention. So that's a very powerful example for partnership. That brings another question, and for that I would request Ms. Devdatta. My question to you is that we are hearing from different panelists that not-for-profit organization can do a lot of effort and can bring attention on those areas which are likely to be ignored, for example, cleft lip on cleft palate. So from a corporate perspective, what would you say that when corporate is giving, sharing the resources as part of corporate social responsibility, what as a manager you would like to see in terms of measuring impact, like what kind of delivery model you think that they should be following, and that is really exciting for corporates?
Thank you, Dr. Chandrakant. I think you touched upon, and the speakers before me touched upon, a very important aspect. One of accessibility and one of collaboration. I think these two are the most important, aspects of coming together. Now, if we do this collaboration, if we do this accessibility, I think a lot can be improved even in the current situation, given the fact that, there are so many limitations. But, if we try to solve the limitations, I think that's going to take some time in our current scenario. So I would, we do a lot of work in primary healthcare, and in fact, I was having a chat with Anjali before this session. And definitely, a lot of things can be brought together. So the way we are now approaching this, having come to a certain maturity of learning, is that to bring, to connect our partners. So we get, to work with different partners who can actually address certain specific areas. Now, in the rural communities, as most of us know, primary healthcare itself is, just getting primary healthcare there is great. Because I have been to places where they say that, even to get a tablet or an injection, they have to travel 50 kilometers. Now, if you're talking about last mile, I mean, what is it really that, is getting addressed? So, people actually would die of even fever, something, I mean, in today's day and age, because of even lack of access. So I think that's one of the things that we need to focus on. And also in terms of infrastructure, even basic infrastructure, roads are not there. Electricity is not there. How are you going to even run, your basic medical equipment? If you need to bring city doctors to make them accessible, you need an infrastructure, right? So you need maybe internet connections and, whatever it takes. So I think these things are very important. And the one more area that I would like to touch upon, and that is manpower. So the skill available in these remote areas is almost negligible, and people don't want to travel to these remote areas to even get, it's very difficult to find people over there to even run these things. So we may have this great idea of saying that, okay, I'll reach to such and such corner and I'll do so and so, but we just don't get people. So I think one of the interventions that should come in this place is definitely skill building in some form. If not medical, at least paramedical, at least that can be made available, which will also address the employment, skill building. It also addresses many other buckets of the SDGs. So I think a combination of this, and this is not very difficult. It's still accessible. It's only the question of joining the dots and putting things together. So I think within the available resources, before we embark on something really big, I think this is something that can be easily done, and it can be done right away if everybody comes together.
Thank you very much. So what I heard you saying that we should not be very ambitious, or the not-for-profit should not be very ambitious just because they want to do something profound. Start with the basic interventions such as capacity building, then improve access, and focus upon primary health care. Thank you very much for those points. I want to retain or keep some time for audience questions also. So I'll quickly move to my panelist, Mr. Anshu Taneja. Anshuji, you made a very powerful presentation on power of simple intervention of eye testing and providing specs to the individual and how it can alter things. You have long years of experience in this area, and in this room we have some representatives from the corporates and also from not-for-profit organizations who are looking for CSR funding. So my question to you is, from your experience, what would you like to share that what are the absolute essentials by not-for-profit, which would be win-win for them getting CSR funding and for corporates so they can see that their monies are well utilized. So win-win for both in a not-for-profit sector.
Thank you. I'll reveal all my secrets. Right. I think what's important, first of all, is that the power of the intervention that you've chosen. I think, first of all, it all starts with how passionate about the work that you're doing. If you're passionate about a problem, if you want to solve that problem, if it's simple, it's scalable, it's easy to understand for people, then funding would follow. Funding has never been a problem. Let me tell you, funding is not the issue through which these problems in India and around the world are not solved. As I said, I talked about Twitter, right? $44 billion he's buying Twitter. $5 billion it takes for, getting glasses to everyone in the country. So it's not big money. So money is not the problem. The problem is that, we need to get a machine right. When I say machine, simple, powerful idea, scalable idea, human resources. It's a huge challenge to get good people. And you talked about rural areas, but even in urban areas, it's a big challenge. It is the biggest challenge for anyone running an organization, is to get the best people who with complete ownership take and are passionate about the cause. So getting that piece right, getting technology right, how technology can be an enabler. Sometimes what happens is that we become slaves to technology. Technology takes more time, in kind of us sorting it than it helping us. So how technology can help us, how we get the best people, how we get a powerful idea, and how we should prevent, all of us, through our education are used to using jargons. But ultimately, the power of speech is, the more simpler the speech, easier to understand, the more attention it gets. Also, how that, the work that you're doing can affect so many multiple areas. Again, we talked about vision. So vision for weavers and artisans is all about productivity, all about income earning potential. Let's talk about what are the key missions of the Indian government. Digital India, is it possible without vision? No. Beti Bachao, Beti Padhao, possible without vision? No. Atmanirbhar Bharat? No. You talk about any mission that the country is doing, the work that we do, and what we've done is kind of aligned the work that we're doing with these things which might not interest people who are just focused on healthcare, but it gives us avenues to get into funding areas which are not healthcare related. So expanding your horizon, keeping it simple, and then the whole point about working in silos. So when I showed the slide about 750 partners, we're working with artisan groups, weavers, NGOs in education, NGOs in road safety, corporations who are doing all kinds of things. For some corporation, we are a road safety initiative. For some corporation, we are a skilling initiative. So when you work with all these different kinds of partners and stop being in a silo, because what it really takes is for people to get together, collaborate and solve the problem. I see my friend Shekhar in the front seat from India Vision Institute. They do similar work, right? All of us need to get together. 60 crore people, one organization is not doing it alone. We all need to get together. We need to across sectors to solve a problem. So keep it simple, keep it powerful, and also be passionate about it. So that's the only mantra. There is no other mantra.
Thank you very much for revealing your secrets. Well, before concluding this session, I'll come back to each of the panelists for 30 seconds, their comments. But before that, I would like to invite participants, audience to ask a few questions. I see a few hands. One hand is there. Okay, so if somebody can pass the mic. Please keep your question brief and please let us know that to which panelists you are directing this question. Thanks. One hand is here. Anyone else? Okay. No. Three. Like 1, 2, and 3. It's on.
It's on? Yeah. Good evening. And in fact, I just want to share a few of my experiences. I was fortunate to be the core member for 108 Ambulance, 104 Fixed Day Health Program, HMRI, and Arogyasri Community Health Insurance Scheme. What all we are talking today, in fact, we have really worked on all these areas where we can reach the last mile. And we are very, very successful, and we have done that, and all the numbers talk about it, number one. Number two, we need to have today the phygital experience, both physical and digital. So now I represent an organization called Apiron Healthcare, where we are taking the hospitals to the villages. It's a mobile hospital. So quickly, I just want to ask Mr. Rajesh, in 600,000 villages in India, I think most of them know Coke. So how these people can know these kind of initiatives in healthcare, where these people can get benefit out of, say, for example, Smile Train or something like that.
Thank you. We'll collect the question and then come back. Okay. Let me first, Dr. Sanjeev Upadhyay, then I saw one hand there, and yeah. Gentleman in the jacket, and then Dr. Gaurav Arya, and 1-5. So please be really brief. Dr. Sanjeev, here.
Thank you. This question is directed to Mr. Taneja. We are seeing that more and more state governments are now having universal screening and also distribution of spectacles, and others are following them. So where do you see your interventions when we are seeing government itself is pitching in putting so much of resources and investments in eye care, especially for vision, the kind of your intervention? Thank you.
Thank you. Gentleman in the jacket toward the back, and then Dr. Gaurav.
Hello, I'm Dr. Suresh from Public Health Foundation of India. I have a comment and a question. The case that you described, Dr. Chandrakant, I actually have an image where when we went around Orissa and the border area for Andhra, just after the cyclone, there was actually an old lady curled up in the Swachh Bharat toilet, not fully finished anyway. And she had only three things which apparently the government has actually provided: the half-finished toilet, the what you call mosquito net, and then rations that were actually provided by the government. And that's the entire kind of assets that she had. She had a house which was also washed out. And broadly, if you'd want to think how to take healthcare to this person, there are probably two ways. One is digital health, which is actually picking up. But the other, probably often overlooked component is the mobility solutions. Because again, a lot of panelists have also spoken about healthcare actually requires products. It's not just data, it's not just upskilling, but rather a constant interplay of products. And the challenge here is we also need India-specific solutions. A lot of the solutions broadly are from the West and then kind of superimposed on the Indian ecosystem. My question to the panelists is, how much of support that you are actually giving to India-specific innovations? Do you have examples? Do you have successful examples? Because this is what I think leads to sustainable, scalable solutions, not something that would be perpetually dependent on support from external agencies. Thank you.
Thank you, Dr. Gaurav. I think we will take only 5 questions in this round. And here, Dr. Gaurav, and then. Okay. I see many hands. I'm really sorry. I cannot accommodate all those. Probably you can catch hold of speakers later on. But Dr. Gaurav, and then.
Yeah. Thanks, Dr. Chandrakant, and thanks for the lovely discussions, panelists. One very quick question I had, and all of you have been involved in different programs, but when it comes to sustainability, many of these programs fall short of making them sustainable. One of the key elements behind it being financing of innovations that we think are innovative, that we think are consumer-led or community-led, but never see the day of light. One insight that I would seek from you, having funded these programs for a long time, is what your experience has been in terms of leveraging funding from other partners, from governments and other stakeholders to make it sustainable and wean out of it. Thanks.
Thank you. And then last question from second row, yeah.
Yeah, hi. This is Jignesh Patel from Jivika Healthcare. So I'll be very quick. As Mr. Taneja has said that, the funding is not a problem. As we are very new into the ecosystem and we are taking basically health and wellness center on wheels into hard to reach areas. So my question is with Ms. Anjali. So basically whenever we are reaching out to, you can say, large size corporates, they have, typical, you can say, focus areas which is hard rooted into their, you can say, system, and they say that, we are typically working on this area only. And when we talk about, you can say, when we started working to the hard to reach villages like, you can say, Jharkhand or you can say Assam, where the basic primary healthcare system is not there, just the way Vision Spring is working for the eyesight. So wanted to understand that how we can, work towards step by step in terms of communication, and how we can, try to change or accommodate their, you can say, focus area and accommodate those primary care into their upcoming focus areas.
Thank you very much. So before I invite my panelists to respond to questions, I really reflect about the last question, that we keep hearing that there is no shortage of funding or resources, but the reality of life is that there is always shortage of funds than we need. The other challenge which you also flagged is that the majority of time, no matter which sector, whether it's a health sector, other sector, the same intervention keep getting funding. Like a certain, I don't want to name a few, but the same intervention, because, and even the corporate give funding to the same intervention because they see that there is a lot of work happening in this area and this is very exciting, we should also fund. And I think that mindset, probably through dialogue, need to be changed. And I want to flag one issue, that globally there is a group of disease called neglected tropical diseases. By the mere name, they are neglected tropical diseases. There are 20, in India there are 11 diseases. But nobody pays, devote that much resources on those NTDs. So because each of the panelists, other than Ms. Devdatta, has questions, so my question, this fourth question is for Ms. Devdatta, that do you see in the time ahead, there should be some mechanism for the corporate to explore and do the landscape analysis, that, okay, these are the areas which are not funded, they may not deliver result in short term, but those should be prioritized. So this is a question for you, but we will go in this order again. Thank you. Or maybe we can start with you. Do you see a time ahead where corporates would look at the neglected area, would put the money where it actually needed and not continue to feed what is already being done, or there are many players in those areas? Somebody who should take responsibility for neglected ones. Thanks.
I think that's a brilliant question, and I think I would like to rephrase it a bit. It's a question of mapping the funds to the requirement. I think that's the basic thing, right? So today, I think CSR has become a differentiator for corporates. So definitely this mindset that you're saying that, you know, corporates will go where everybody else is going, I don't think that's true any longer, because people want to differentiate and say that, okay, I'm doing something that is very unique. And everybody wants to do something that is unique, and literally, if I may use a cliche to say that, go where no man has gone. So I think that's one of the things. But the issue which I find from being on, you know, I've been on both sides to some extent. I mean, I've never worked with an NGO, but I think the issue that we face is that the pitch is never right. I think what the person who's seeking the fund, he's also very focused on only this is what I want. And he's also not going to the people. They don't do it. I mean, there isn't enough research done to see who are the people who would be, you know, funding those, you know, whose CSR objectives are matching that. So I think if that research is done a little bit more, then I think you can have a better success rate of, you know, marrying the two.
I'm sure this is very valuable for the audience here. Thank you. Okay, Anjali ji.
Yeah, so
we have a timer there,
yes,
so I request 30 seconds.
I'm looking there also. So the most important question for all NGOs, and especially to get CSR funds. Yes, it is a challenge, but I think there are 2-3 things that we should be mindful of, and I think Devdatta has said, we have to understand what that corporate is also looking for, right? We can't just go there with our own mindset. You have to do your research. You have to understand what is valuable for the corporate that you're approaching, one. Second, especially in today's CSR scenario, compliances are so high that accountability, your ability to complete projects on time and, you know, make the corporate look good with their stakeholders, their board, etc. So that is really important. And I think I agree with you that a lot of times corporates have their own areas of intervention. But I think it could be 50-50. Maybe some of it goes to there, and then you can also appeal that these are the areas which are completely affected. Could you also look at those? And maybe approach MNCs or consumer-facing companies who are selling, I mean, their consumer is across the country. So approach those kind of organizations, because, you know, they would also like to look good in front of the end customer, which is the consumer.
I think the traditional donor-donee relationship is changing. I think the way to go about is that approach as equals, right? You also, as implementation partners, doing great work. Corporates need you as much as you need corporates for funding. And then, you know, the whole idea of saying that, you know, we are not a corporate, this is a corporate, you know, again, all jargons. NGO is a jargon, social entrepreneurship is a jargon, corporate is a jargon. There's only two kinds of organizations in the world. Organizations that are doing good and organizations that are not doing good, right? So if you're doing good, the other side also, the funder appreciates you, and there is so much to learn from corporates. Let's talk about Coca-Cola. The biggest, most powerful distribution in the world. So much organizations like ours can learn on how to take products to people, how create acceptance of those products. Anjali talked about awareness. If people are aware about, Coca-Cola, what kind of marketing would have been done to make them aware and maybe in a way addicted to the soft drink. So, those are the things that we can learn. So there is a lot of humility required on both sides. Similarly, corporates can learn a lot from implementing organizations. So go as equals, co-create, keep your pitch simple, and then you see that it's a beautiful harmony happening.
So I see the time is up, but I will just try to address your question. See, we have to look at two things. One is how we can leverage our existing strengths. Like, I will quote a project which happened in Africa. It was called Project Last Mile, where the existing distribution system of the Coca-Cola Company over there was used to deliver medicine to the last mile. So similar possibilities are there in India also. We were having some discussions, some thoughts about that. And I actually recall my experience with one other organization that I used to work with earlier, which was Unilever. And in fact, I was posted in Assam in one of the remotest areas. So there we used to send an ambulance to one village every day over a rotation of a month. So that ambulance contained a doctor, a couple of nurses, basic medication. So they would do primary health check and keep tab of how the people are progressing in that. So this is just one way of doing it. Maybe it might not be the most effective, but yes, we can always look at innovation into doing more things more effectively. Thank you.
Thank you very much. So what we hear that there is an interest and desire to work together between corporate and not-for-profit organizations. There are learnings which can be utilized. I know time is up and we have used exactly the amount of time given to us. So to conclude, I would like to start by thanking the wonderful audience. My sincere apology that I could not take all questions, but as a moderator or as a panelist, we are always happy when audience asks questions. So thank you very much for asking questions. My special thanks to each of the fellow panelists. I must say that they were really candid, shared some of the million-dollar advice, and just 30 seconds or 1 minute. So thank you very much for being on this panel. Thank you very much to the organizer. We close this session. Thanks. Bye.
Thank you. Thank you, everyone.